Hi, everyone. My name is Dr. Elizabeth Berliner, and I wear a few different hats professionally, but today I am speaking to you as the Shelter Medicine Regent for the Shelter Medicine Practice Specialty with ABVP. And I've been asked to spend a couple of minutes talking about the difference between shelter medicine practice and general or community practice. And so I'll start with a little story. When I worked at the college with veterinary students, I often would ask them this exact question. What do you think is the main difference between working in a shelter as a veterinarian and working in general or community practice? And inevitably, the first answer I would get is that shelters have limited resources. Put more bluntly, shelters don't have any money. And so I would pause for a moment and then discuss with the students that while indeed many shelters are resource challenged, many pet owners are resource challenged. And many shelters have resources, just like many families have resources. And so, although it's true that many shelters are resource challenged, that's not necessarily a distinction between how we might practice with a group of animals in a shelter versus a group of animals in a practice setting. And so I'd push for some other differences. And generally, we would come around to something the students would usually say, well, in a shelter, you practice herd health. It's a herd of cats instead, or a herd of kittens instead of a herd of cattle, but you're practicing herd health. And so I would ask them, what does that mean? And we would generally get into a discussion about the fact that when we are working in shelters, there is always a need to balance individual animal care and population level care. You are always placing that animal in the context of its impact on the population, whether that is an allocation of resources or an allocation of time and staff, or whether that is an impact that has to do with infectious disease. Will this individual animal essentially impact the rest of the population with the infectious nature of their condition? And so that is true. There is also the element, though, that owned animals in our community also come in a context where, while we may be focused on that individual treatment plan, it is in the context of a family with particular resources, with particular ability to provide care, and potentially with some other contextualized care issues of their own. And so there are some parallels there that when you really start to look at it, there are nuances. Having said that, undoubtedly, when we are working in shelters, we are very aware of that individual and those population dynamics and constantly looking at balancing them. We need to make sure that what we are doing, while it provides for appropriate care and welfare of that individual, does not compromise what's happening with the rest of the organization, both the animals and the people in that organization. And so in order to do that, in shelter medicine practice, we're heavily reliant on protocols and sort of a protocoled approach to practice. This allows for an economy of scale, meaning we have a particular inventory of products that we use them consistently across the vast majority of the population. And so we really can kind of manage our inventory based on those protocols. It also has to do with doing the most good for the most number of animals. And so in order to do that, if we are taking care of both the individuals and the population, we are often enacting kind of standard protocols across the board for every animal. And so I'll give you an example of protocols we would use for preventive care. One would be, for instance, an intake protocol that would call for standard core vaccinations in shelters, and core vaccinations in shelters may look different than those in practice, but all animals coming into the shelter get these core vaccinations at intake, at the point of entering the shelter, and they get them reliably across the board. And that is both to help that individual animal, but also to provide that sort of herd immunity within the shelter itself. They may get broad spectrum treatment for endo and ectoparasites, and we may do that rather than testing for those organisms, because providing prophylactic treatment or preventive care in those instances is just a more resource appropriate approach to being sure that the animals are essentially protecting the population. We may also use protocols for interventional care. So we will have protocols designed to address the most common conditions that we see in shelters. And so the staff may have the indicators to look for an infectious disease. We'll use upper respiratory, for instance, and then essentially we'll enact a treatment plan, potentially antibiotics, and those antibiotics may be very standardized. Every animal is going to get this approach unless they're an outlier for some reason. And if they're an outlier, then the veterinarian will be flagged to evaluate and treat differently than the standard protocol. But the vast majority of times we see these common conditions, they will get this protocol treatment. These protocols are written and approved by a veterinarian like yourself. That veterinarian has knowledge of the population, knowledge of the facilities, knowledge of the risk factors that come into play in that community. And so they have written and signed off on these protocols, and then the staff enact them. This also speaks to another important part of shelter medicine practice, which is highest and best use of all staff in providing this care. So we are going to utilize our technicians at their highest level. We're going to utilize our support staff at their highest level. And we're going to use veterinarians for what veterinarians need to do, which is diagnose, prescribe, and do surgery. So we're really going to try to make sure that the time of our medical staff is spent to highest and best use. And again, protocols allow us to do that and make us fairly efficient because we know what our standard approach is and we're not having to make different decisions all of the time. We are enacting what does the most good for the most number of animals. So why, as a veterinarian, would we want to engage in shelter medicine practice, particularly if it's not what we do as the majority of our work? And I would argue that a big reason is that the impact of what we can do in a shelter is profound, especially if, as we are doing this protocol of medicine, as we are providing this population level care, we are really dialed in to proven protocols and practices that have been developed by the shelter medicine field. And so we are super fortunate that in the last couple decades, we've had extensive development in textbooks and web-based resources and guidelines from groups like the Association of Shelter Veterinarians and the board specialty with shelter medicine practice. And so we really have a lot of information and resources that have demonstrated what works well in shelters and what can be provided at that level efficiently with the staff that is kind of standard for this practice. And so you don't need to start from scratch, I guess is what I'm trying to say there, is that a lot of this is already pre-existing. There's lots of resources you can reach for, lots of sample protocols you can reach for. And then there are also shelter medicine consultants like myself that are happy to engage in helping you adapt a kind of sample protocol to what works best in your shelter and your community, given your population and risk factors. And so all of these things can be adapted, and you don't need to start from scratch with this work. It is important that as the veterinarian, you know what's happening in the shelter and that you are dialed into what's happening in the shelter, but you're not expected to start from ground zero. Animals in shelters really reflect the needs of animals in shelters, reflect the needs of animals in the community. And so this is also where I want to point out that animals in the community become animals in the shelter, and animals in the shelter, when they're really lucky, become animals in the community really fast. And so when you are working with a shelter and engaging in this practice, it's really just an extension of the spectrum of community practice and the animals that are walking into your general practice. Any owned animal may find itself in the shelter tomorrow for one reason or another. And obviously, animals adopted for the shelter, clients come into your practice, with the joy of having brought home a new pet. And so ensuring healthy practices in your community shelter helps to improve the community health overall for animals and families and animals being taken care of in the community by caretakers. So this is all an important part of the same web of care, the same safety net of care that we all want to provide to our community. So thank you for all that you do, and I hope to see you at the shelter.